So what kind of healthcare solution does Inostics provide?
We can take a tube of blood from a patient, and with that tube of blood determine if they have cancer, what types of mutations their cancer harbors. So with that information then you can now choose a therapy that targets those mutations. So it's important to identify which colon cancers have which mutations. And then a lot of the pharmaceutical companies today are developing drugs that targets very specific mutations.
So how does the Inostics solutions help me figure out where my mutations are at?
If we know there are common mutations in colon cancer, we can take a tube of blood and find these mutations. The unique thing about Inostics is that it can find amounts as low as 1 in 10,000 molecules. So it's like finding a needle in a haystack, and Inostics has kind of a great metal detector to find this. So with that, you can then choose a therapy that you may better respond to.
What kind of companies are you interested in partnering with once you figure out how to deliver this quickly?
Our primary customer would be pharmaceutical companies at the moment who have maybe an array of targeted therapies that they're testing. So what they would ideally like to do is, if you're going to have a clinical trial that targets a specific mutation, you would like to know whether a patient harbors that mutation in their tumor. And this helps the patient as well, so that they don't waste any time joining a trial that may have no benefit to them.
So you can quickly identify if this patient is a good fit for the trial that the pharmaceutical company wants to put on.
Exactly.